All right, Stefan Hartman here, Iron Direct Primary Care. First ever podcast on the channel. We're interviewing Logan Trudell on itslogantrudell Instagram. He's owner of Bedside to Beachside Method, previous nurse. Logan, you're in Colombia right now.
I am. Thanks for having me, Stefan.
This is pretty cool. You got a jungle in the backyard, living the life. How did you go from a nurse working the unit to Colombia kind of digital nomad?
Yeah, I mean, it's a long story, but basically when I was a nurse, I started, in order to relieve stress, I would go and travel. I found that was one of my biggest passions. And I met somebody along my path who was making less money than me, and he was enjoying his life much more. He was actually here in Colombia, and he was on the top story of a big grand building. He had a barbecue on the rooftop. He had a projector for movies, whole entire view of the city, and he was paying less than what I was paying in rent for his whole entire month expenses.
I've heard that about Colombia.
Yeah, it really just shocked me. Jaw dropped. It was kind of a bad feeling too, because it was like I invested all of my time and money into my dream profession in healthcare, and I'm realizing that people are living lives of less stress, and they're not even making as much money as me, and they're happier. And that kind of started to get the wheels turning. And then flash forward, I developed eczema when I was working as a nurse really badly. Coworker committed suicide. And those thoughts that I had before about wanting to just leave the profession and move abroad, they came back. So I ended up quitting my job December 31st, 2019 as a nurse. It was really scary. Did not really know what was going to happen, but I knew I had to make a change, and booked a one-way ticket to Colombia, sold everything I had, and moved there February 11th, 2020.
Wow, amazing. And your eczema, did that resolve?
Yeah, it took about, I would say, 8 months, but it resolved after removing myself from the stressful environment and working on myself more.
Probably also getting more vitamin D, eating better.
Yeah, the whole lifestyle change. One of the reasons I moved here is because, I mean, there's cab drivers here that are happier than the people that I used to work with. Yeah. They're making nothing, and they're just happy, full of life, vital.
Yeah. Yeah, I understand that completely. You know, working as a PA, you know, conventional medicine, it burns you out. It's like constant grind, especially, you know, mid-levels nurses, you know, they want to grind us. They see us as numbers. They see us as revenue generators. The more patients we see, the more, you know, we can churn the numbers, the more these industries make. We make them money at our expense, at our health costs.
And with the people, yourself included, and the people you've worked with, do you feel that the narrative is beginning to change as more people are waking up to what healthcare really is, a business model versus an area for a bunch of people to become healers and help people? That's what we all get into the business for. But we realize that we don't have as much power as that we thought we were going to have.
Exactly. We spend all this time, we spend all this money to go for this education. We want to help patients. And then the reality is that we're numbers for revenue generators, and helping patients is maybe just a bonus if you're able to spend more than 15 minutes with them. And I feel like there is a movement where healthcare workers are moving away from this. You know, I started Iron Direct Primary Care with a colleague of mine. You know, we've just been seeing this coming for a while now. This crunching the numbers, it's getting the patients in, pushing the pills. And we started Iron Direct Primary Care, a method of breaking away from the insurance model and providing a platform for practitioners to come on board, create their patient panel, and start seeing patients the way medicine was supposed to be, which is seeing everyone as an individual, spending the time, getting to know them, figuring out the root cause of what's going on, and reversing the disease if they have a disease, or just keeping them well, and by preventative measures. And we're not just talking about your mammogram every other year, your colonoscopy. We're talking about real preventative measures. We're talking about looking at it from, nutrition, exercise, longevity ways, not just your basic primary care screening. A whole other perspective of medicine is it's a holistic perspective. It's functional medicine. It's integrated medicine. It's just a whole different way of thinking about medicine from a lifestyle perspective that you're not going to get in a 15-minute seeing your primary at the office, where they have to diagnose you with 5 conditions so that they can bill at a 215, so that they can charge Medicare $300, $400, and they have to see the next one so they can see 30 patients in a day, so that they can make the company that they're working for, $500,000 a year or more, so that then you can get paid, 150 or whatever it is that you're making. You feel happy about making that much, but are you really helping the patient? No, you're helping whoever you're working for make money, and you're burning yourself out. And maybe you're delivering some care if you put in the extra time, if you burn yourself out, if you stay over hours, charting for 4 hours a day because you spent that extra 15 or 30 minutes that the patient needed. So you're pushing yourself to the limit. And, healthcare workers are sick. They're so sick.
They're sicker than a lot of the patients. Yeah.
They're sicker than the patients.
Yeah, something that I wasn't taught, and I don't know many people are, is how vital and necessary your energy is. You have to protect it at all costs. And when you sign up to become a healthcare worker, when you help facilitate healing, or even just in the process in a room with someone who has a lot of shit, a lot of baggage going on inside, that stuff comes onto you, and you have to be really strong. And if you were just seeing thousands of patients a week because the systems are just churning them out to you so they can flip over another bed, it does a disservice to the whole entire system. Of course, the business profits, but what ends up happening is you got the great resignation. Everyone's quitting.
Everyone. Yeah. And who's going to suffer most? Well, it's patients are going to suffer because they're not going to have the providers. But if more providers, go with their own models, so we have to create our own models of care, like direct primary care. That's a great model where it's a low cost subscription-based service for patients. We act as basically the whole package. Insurance. We are the insurance. We are the provider. We're all in one.
But does their insurance cover that or no?
No, insurance doesn't cover it.
So it's all out of pocket.
It's all out of pocket. You can use your HSA card or some funds, but it's supposed to be very low cost. And the goal would be to just keep you healthy so you don't have to rely on the sick care system, which is a lot more expensive. Sure, you should probably keep like a catastrophic insurance plan. Medicine and hospitals, they're great for, the catastrophic events. And that's where you're going to rack up a lot of bills. And that's where insurance should kick in. Now, most people, they're getting nothing for paying, for a family of 3, what is it, $1,000 a month? If you have a couple of medical conditions, $2,000, $3,000 a month for health insurance, you get nothing for that, right?
And you ask them for labs to try and prevent things in the future, and they say they can't give them to you.
Yeah. Oh, yeah. And insurance, you order an image, and insurance doesn't want to cover that MRI. You still have to pay $200. That, it's crazy. I can get MRIs done for $200 because I've negotiated good deals with people around here. I can get labs done, affordably. It can all be done outside of insurance. Who would have thought? I talked to my dentist today, and I was like, I want to cancel my dental insurance. I'm paying this every month. I'm not doing anything with it. I just see you twice a year for checkups. You want to do like a sliding scale? And they're like, yeah, we're kind of moving away from insurance on our own because they're not reimbursing us. And we think we can do a lot better just providing our own service. I'm like, yes, that's what we need to do. Provide your own service.
Where do you think that the model is going to swing to? I know many people are waking up to preventative based medicine. It's going to definitely take over. But to what extent? Do you think a lot of NPs are just going to open up preventative care practices? A lot of litigation changes are going to happen.
Yeah, so the PA and the NP and the MD, they all have to start going away and opening up their own services, their own subscription models, whatever it may be, or maybe just fee for service, low cost. Um, just kind of moving away from that. Even specialists, I worked for a specialist, and he was an ortho spine specialist, and he was getting killed on insurance. They weren't reimbursing him for anything that he was doing, and he couldn't afford actually to keep a PA on because of that. The volume wasn't there, and he does an amazing service. We need specialists like that, um, but he's not getting paid. He can't keep a facility running that way. So he needs to figure something else out. And specialists, I know specialists all over the place are getting killed like that too. So they need to figure out something else. Maybe a direct primary care model, maybe sliding scale, something else, because insurance doesn't want to pay for what we offer. But we need to overall lower the costs in medicine so that patients can't afford it. And I think if you're not paying for a bunch of useless insurance premiums every month, you're going to have money so that you can spend on your health, preventative care, maybe specialist care. But the overall costs need to lower. Costs are just inflated over the years to try to bill insurance because insurance reimburses you for a fraction of the amount that you bill at. So that's why the prices have gone up. But realistically, the prices can be a lot lower. And how are you developing an income in Colombia? To explain this bedside to beachside thing, I don't understand it very well.
Yeah, when I first moved here, I was trying to figure out what I wanted to do. I ended up stumbling into coaching and consulting. So I started Healthcare Stress Relief. It was a company basically to help healthcare professionals during the pandemic in stress management. But I found that the further I remove myself from the healthcare environment and go on my own path, the less integrity I'm in if I continue to just try and help people that are still in a system that I don't believe in. So in comes the bedside to beachside program. I developed that. That was basically years of learning what I've learned to be able to get into this position that I'm in now, and how I've met all these amazing people who have helped me become a coach and consultant completely online, remote. So the program consists of 7 weeks of basically helping people understand exactly what they want out of life, what their skill sets are. There's so many healthcare professionals that have amazing skill sets, not only just in relation to what they've learned in school, but also you have to dive deeper than just, oh, I'm a nurse, that's my identity. You are something so much more than that. So diving into all that so we can identify exactly what you want to do. There's 3 big options that are going to completely take over. That's freelance work, remote working, that's still tied to a company, and then you have your own business. Most people can start with remote work just to dip their toe in the water, and then move to freelance, building their own portfolio, working for themselves, and then business owner. I just dove right into business owner. So
yeah, makes sense. Understanding your own skill sets. I've always tried to keep side hustles going. Tennis has always been a huge part of my life, so I've always been coaching throughout my education.
I didn't know you were a coach. Cool.
Oh yeah, I do tennis professional tour, so I play on the tour, and then I also coach pretty much every evening. I'll teach kids after class, or sometimes high performance athletes as well. And I'm starting to look into personal training again more. I actually was a master trainer at LA Fitness before I was a PA.
Oh, really?
Yeah, I trained a lot of people, and I want to start doing that again because I have a whole background in that. I graduated exercise science at UCF as well.
Yeah, you have a lot of tools to leverage.
I do, and I'm also looking at publishing my own book this year, either this year.
What will that be
year.
about?
It's a science fiction. I've been writing it for the past decade, and it's
science fiction.
Yeah.
No way.
Yeah. And yeah, it's in the final touches. I've had a lot of editors go through it, and I'm probably going to look at self-publishing either by Christmas time or early next year.
How was the writing process for you?
Oh, it's been a learning process. I was when I started this out, it was a long time ago, 10 years ago, and I wasn't very good at writing. I just had the idea and I put it down on paper. And I wrote it all, and then it's been editing and learning how to actually write ever since then. Now, when I went to university at UCF, I had the option of doing creative writing, undergrad, or exercise science. Thankfully, I did exercise science because there's no money in creative writing.
Yeah, now you can get the degree on your own terms.
Yeah, I mean, you don't need a degree for creative writing. It's just been learning. I've been reading books on it. I've been getting a lot of feedback. I use this website called Scribophile. It's where a lot of writers go and put up their work. You get critiqued. I got like thousands of critiques. I just learn from those critiques, and now I finally had like a professional editor. A couple of them go through it, just put in their feedback, and it's come together.
Cool. Yeah, I've known many authors, and they all describe it as like a birthing process.
Yeah.
But by the time you finally reach the finish line, you just feel like dead.
It's a process. You can't rush it.
Yeah. Cool. That'll be epic.
Yeah. It's exciting. And it should be a 2-part novel series. So 1 and then 2.
Awesome.
Yeah. Maybe I'll come visit you down in Colombia. It looks amazing there.
Oh, dude, you'd love it. They call it the city of eternal spring. Basically meaning the weather is amazing all the time. There's no seasons. It's rain and tropics pretty much.
Uh-huh.
So we'll get like a thunderstorm in the afternoon for 2 hours, and then we'll just come back to the sun. That's why it's so green here. It's so lush. It's about, I don't know, Celsius, but it's about 70 to 80 degrees all the time.
Perfect. What city are you in?
It's Medellin.
Oh yes, the big one.
Yeah, Bogota is actually the biggest one. It's got about 7 million people. I think Medellin has 2 million.
Yeah.
But it's surrounded by a valley, and the city's just plopped inside of it.
And do you speak the language?
I speak Spanish. I'm definitely spending more time on it. My girlfriend she's Paisa, which means she's from Medellin. She's Colombian. She's a Spanish instructor, but she speaks English almost better than me. So it's been hard to just go back to being a child talking with her.
Yeah.
But now I'm just paying her to teach me because I need to jump on the horse.
Yeah.
But yeah, I can get by.
I imagine the tennis is good there. I've played many good Colombian tennis players.
Really?
Oh yeah, they're very good. There must be some academies there cranking out talent.
I had no idea.
I don't know. You're not in tune with the tennis scene, but I'd have to look into that. That's usually how I want to travel. If I travel somewhere, it's like, wow, who can I train with? What tournament can I compete in? That's usually why I travel.
There's some pretty athletic people here, pretty healthy. But yeah, I'm sure you could find some serious tennis tournaments here.
Cool. I'll look into it. Well, this brief today, I think we covered a lot of topics that I wanted to cover with you. We may have to do it again sometime when I have more things to discuss with you, but this pretty much covered it for today.
Cool. Thanks so much, Stefan.
Cool. Well, it's great talking to you.
You too, bro.
Bye.
Bye.